Michael is our head of epidemiology in our public health group, and he's really going to take some time now and walk you through some of I think the pressing questions in everybody's minds around prevalence and the cost of autism and these implications of this for access to care. And as this comes forward, I think this represents a wonderful example of how the science mission is diversified in what we do and how it's directly helping to support the advocacy efforts of our group. And this is where we wear our advocacy hat, and we're really proud of the work that Michael and his team is doing. Michael.
Thank you, sir. Hi, thank you all for your patience. I've been called a lot of things at Autism Speaks. I'm Autism Speaks science guy, at least in the Twitter sphere. Thank you to my followers. I know there's some in the audience. I'm called Autism Speaks numbers guy, and you'll see why in a moment, but I haven't been called senator, at least not yet. I want to thank Senator Menendez for being here. The only problem with me being a senator is I'm also from New Jersey, so there might be a problem there. So as Rob mentioned, my name is Michael Rosanoff. I'm the Associate Director of Public Health Research. I've been with the organization for 6 years, and really this is such a crowning a moment for this organization. I'm so proud to be here. I'm so happy to be here. I want to thank you all for coming out, and especially those watching online. Hi, Mom. I really appreciate your support as well. And what I'm here to do today is to talk to you a little bit about the numbers. Actually, one number in particular, and you'll see that number in a moment, but it's not just a number. In fact, the number doesn't really explain all that we know about autism, and actually it shows us a lot of what we don't quite yet understand about autism. And of course, that number is 1 in 88. We've heard it a lot today. You'll hear it over the course of the next 3 days. And there's a reason for that. It's important. This is an alarming statistic. 1 in 88 children in this country, according to the CDC, has an autism spectrum disorder. That is, of course, unless you ask somebody from New Jersey, where they'll tell you the prevalence is actually 1 in 49. Or in Utah, where they'll say the prevalence is 1 in 47. And it's the same CDC report that came out with these numbers. So what is 1 in 88, and where do these other numbers come from? That's what I'm going to talk to you a little about today. Actually, I'm going to make the point that 1 in 88 is an underestimate of prevalence in our country today. I'll show you why. First of all, you need to know how we measure prevalence here in the US. The CDC's Autism and Developmental Disabilities Monitoring Network, or ADDM, is a series of 14 sites across the United States, or 15, give or take how much funding they have in a particular year. And basically what's done is, using medical and education records in those states, experts will look at the data, extract it, and basically make a case for whether or not somebody has autism or not. So in other words, the children are never actually seen. The prevalence is based on records. And this is okay, except you can imagine that in places where there might be better records, you might actually have higher prevalence estimates. And that's the explanation that the CDC gives for this range in numbers. You'll see in red the average. I have a laser pointer. The average here is 1 in 88. But there's actually 9 sites in the last report that reported a prevalence higher than that number. And again, what the CDC said was, well, there's actually more records and better records in those states. Perhaps they're using electronic medical records, for example. So then let me ask the question, if these other states here had better records, would the prevalence not be higher? And then would this prevalence actually be higher as well? And then the other question is, what happens to those children who have never actually been formally diagnosed? There isn't a school record or medical record for that child because they haven't had access to diagnostic services. They're not in the system. So we're missing all those children. So this is evidence suggesting that we're likely underestimating prevalence. So let me ask you another question. What happens when you actually go and start looking for children instead of this passive surveillance system? Well, what happens is you find a higher prevalence. Actually, earlier this year, the CDC conducted a study where they used data from the National Survey of Children's Health. The survey was a telephone survey. It asked parents, has your child ever received a professional diagnosis of autism? And they found that 1 in 50, or 2% of kids, had autism. Well, that's about twice as high as what we saw from the CDC's other approach. Now, there are limitations to this study, of course, one of which is that the cases could not be confirmed. This is a parent-reported survey. So let me ask another question. What happens if you actually go into classrooms and you actually confirm the diagnosis of these kids? And you heard Mr. Wright allude to it earlier this morning. That's what was done in South Korea in a study funded by Autism Speaks, where what they did was they actually directly assessed children. Now, the investigators of this study were very smart, And I'm not just saying that because one of them is a GWU researcher and might be in the audience here. Is Dr. Grinker here? He may be. But they were very smart. They knew this number would be scrutinized. So what they did, it would be scrutinized and compared to the CDC number. So what they did was they actually also measured prevalence using a records-based approach. They used special education records, and using just that data alone, they found that 1% of children in South Korea had autism. It wasn't until they actually went into the classrooms and directly screened and clinically diagnosed these kids that they found 2/3 of cases had yet to be identified. They were previously undiagnosed. Many are in general education classroom settings, and many may be doing fine, but they'd never received a diagnosis, and it doesn't mean that they could not benefit from access to those services. So that's why this study was so important. I want to mention something else that Mr. Wright said this morning. My colleague, Dr. Andy Scher, is not here today because he's actually in South Korea, because South Korea is today developing a national plan for autism based on this alarming statistic. And through our Global Autism Public Health Initiative, we're advising South Korea and actually 50 other countries around the world that are trying to develop strategic programs to help their affected families. And it's not that the United States doesn't realize that that was a great study. Actually, the CDC came to us because this study was done so well and so well respected, and they said, hey, we want to replicate that here in the US. And that's exactly what happened. Autism Speaks helped support a study which is actually a competition between the Atom sites. So this study is taking place in South Carolina. It's a replica of what's happening in South Korea. Not only will it help us better understand the prevalence of autism in the US, but more importantly, it'll tell us why we may be missing cases. And is it because families are experiencing barriers to accessing services? So the question I have to ask right now is, 1 in 88 is pretty high, and it's an underestimate. So how much higher does prevalence have to be before we get a response from our federal government? In just 6 years of statistics being reported by our federal government, by the CDC, we've seen a 78% increase in autism prevalence, from 1 in 150 in 2007 to 1 in 110 to now 1 in 88. And actually whatever's up here, which we'll hear about in a few months from the CDC. But from what you've heard me say already, we can say that that 78% increase, a lot of it is probably due to improvement in record collection, because we know that's how the prevalence is estimated. But then how do you explain this tenfold, 1,000% increase in prevalence since it was first reported back in the 70s? Now, it's true, not all these numbers are really comparable because the methods of the studies were different. But in California, in more of a controlled environment, over the past 20 years, we've seen a similar 1,000-fold increase. So what is driving this increase? And the other argument against why there may be an increase in autism prevalence is because we don't know where the adults are. Shouldn't there be 1 in 88 or more adults affected with autism? We just don't know. So we see the crisis is growing, and although the increase has been rather dramatic, the response from the federal government has been insufficient. There has not been a response that meets the magnitude of this public health crisis. Well, the CDC again came to Autism Speaks and said, look, the fundamental question, really the question that's at the core of everyone's mind is what is driving the increase in autism prevalence? It resonates with parents, with researchers, with providers, with media. And the reason is because, well, we can help understand the underlying biology and develop more effective treatments, but also because parents want to know what has caused their child's autism, what's causing their loved one's autism. So the CDC came to Autism Speaks and we held a think tank. Unfortunately, that did not turn into an action tank. But at the think tank, we brought together some of the greatest minds in this area. And what we heard was that, well, part of the increase is due to things like greater awareness, change in diagnostic practices, like the shift in diagnostic criteria, specifically the diagnosis from mental retardation to autism, and also some social factors like parental age. We've seen that parental age is a risk factor for autism, although it's a moderate risk factor. But after all that, and a day's worth of conversation, it was determined from all research that we have to date that at least half of the increase in autism prevalence over time is still unexplained. It's due to unidentified factors. This is frustrating. We know autism has genetic underpinnings. We heard from Dr. Ring earlier about some of the genetic risk factors for autism. But there are no causal genes. There are no genes that cause autism. That means that not everyone that has these mutations will have autism, and not everyone that has autism has the mutations we've identified. We know that there are some other factors that interact with genetics that actually might trigger one's autism, and those factors are likely environmental. But we know very little about this relationship because we know very little about the environmental factors, the risk factors for autism. There's been some research on some potential culprits. We've heard things like exposure to air pollution during pregnancy, things like PCBs. Also, we've heard about maternal inflammation and other complications during pregnancy. But all of the findings, the effects are very small. The risk is not that great. We don't know much about postnatal environmental exposures. We really don't. We don't know much about preventative exposures like folic acid. The findings there are very mixed. In other words, what I'm trying to say is there is no actionable information. There's not enough information to inform the practice of parents, their decision-making, the practices of doctors or others. And that's what's entirely frustrating to the community. My argument is the reason for this is the lack of investment, the lack of financial investment in research, specifically focusing on environmental factors and other autism risk factors. Now, I have to come up here and say that I am very proud to say that Autism Speaks is playing its part in this. We have funded over $200 million in research over the past 8 years into genetic factors and environmental factors, things from early detection all the way to adult services, scientific conferences and fellowships. $200 million is a lot of money, and we've really done a great job, I think. But $200 million is a drop in the bucket compared to what the NIH is capable of doing. The NIH's budget this year alone is $193 million for autism research. They've dedicated about $200 million to autism research. But that is a drop in the ocean relative to the $31 billion budget that the NIH has. And my question to you and to the federal government is, how come other conditions that have a similar prevalence to autism are getting much more funding than autism is? Let's take a look here at HIV/AIDS. HIV/AIDS is receiving $3 billion. That's 15 times the amount that autism is receiving, yet the prevalence of HIV/AIDS globally is also 1%. 1% is our best estimate of prevalence of autism globally. But in the United States, HIV/AIDS only affects about 0.5% of the population. Here in the US, it's at least 1%. So I'm not saying at all that HIV/AIDS should not receive $3 billion in funding. What I'm saying is that autism needs to receive at least that much money, if not more. Now, when we all go to the Hill tomorrow and talk to our policymakers, the ones that have done their research are going to say, hey, we've actually increased the funding for autism over time. And they have. They wouldn't be lying. They've increased funding over the last 5 years. The problem is the rate of increase in funding has not met the rate of increase in prevalence. It's simple math. And the statistics are coming from the federal government. We've seen a 78% increase in prevalence in 6 years, yet only a 52% increase in autism research funding over that same time period. What that means is the amount of money that the federal government is spending per person with autism has actually gone down. The federal government is spending, $53 per person affected by autism in this country. We heard today that families themselves are dishing out $50,000 a year to take care of their loved ones. The costs of autism are astronomical. $137 billion with a B is the cost of autism to society in the United States per year. And for an individual who's profoundly affected with autism and intellectual disability, the average cost over their lifetime is $2.3 million. This number is a function of prevalence. As prevalence increases, costs increase. This number is based on 1 in 88. So what do we know about this number? It's an underestimate. The cost of autism to society is actually higher than that. And one of the reasons is because autism can be a lifelong condition. It starts early in life and can go all the way through adulthood. And so we see the costs that are associated with autism at different stages in life. We know that the cost of behavioral intervention, special education, is very expensive. And this cost is shown here early in life. We know that medical services are expensive. Individuals with autism have medical needs just like anybody else, except they can be more severe. We know that individuals with autism, their parents are unable to work and make as much money as parents of children that are typically developing. We see that mothers of children with autism earn 56% less than their counterparts of typically developing children. And also, one of the biggest expenses to adults is residential care. And our Family Services Department will talk about that. So how do we combat this cost issue? Well, one is getting earlier access to early intervention services. We know that early intervention services improve long-term outcomes. So this is one approach early in life to reducing costs. In a study that's in preparation right now that was supported by Autism Speaks, we found that children who received early intervention had more expensive services earlier in life. But as they got up into school age, they started to use less services than those who hadn't received early intervention. And these aren't people that aren't receiving any services at all. They're receiving the next best thing. So while it's more expensive up front, the cost savings actually starts about 10 and a half years after receiving early intervention and lasts throughout the lifetime. So the return on investment could be huge. And Autism Speaks appreciates this. We've launched the Early Access to Care initiative, whose goal is to increase access to early intervention services by also increasing access to early detection services. But for us to be able to scale this up and to reach some of the most underserved and underrepresented populations here in the US, we need the federal government's support. We know that individuals of ethnic minority groups are more often diagnosed later and receive less services because they have less access, and we need the federal government's help in getting services to those individuals. But also, we can't forget about the 50,000 children who will become adults this year. And the number of adults that are out there today could be over 1 million, maybe close to 2 million adults. This graph up here is showing that even though we've seen an increase in research funding, the distribution of that funding has not been equal. In fact, I already mentioned that environmental factors research is underfunded. Well, in 2010, only 4% of research funding went to adult research. Only 4% of the papers that were published in 2010 were on adults. Now, that's changed in the last 3 years, in part because Autism Speaks has really prioritized this issue. But we can't do it alone. It's not enough. We need to get better services and better access to better services to adults who should be afforded the opportunity to be able to seek employment opportunities or education opportunities or live independently. We just don't know enough about this subject to help this large number of adults that are out there and the children that will become adults in the near future. And so I just want to kind of summarize what I've said here and give you some tools that you can take to the Hill tomorrow when you speak with the policymakers. And of course, the first statistic we start with is 1 in 88. And when that policymaker says to you, well, prevalence, I know it's 1 in 88, well, you say, actually, that's an underestimate of prevalence in this country. It's most likely higher, closer to 1 in 50, maybe even higher than that. But even if it's 1 in 88, using that number, we know that there are at least 2.5 million individuals in this country that are affected by autism. And to borrow a line from Mr. Wright, there are 20 people at least that one person touches, meaning that 1 in 6 Americans in one way or another are touched by autism. This is an urgent public health crisis that demands an urgent response. I want to mention that other countries around the world are listening and doing something. I've already said we're working in over 50 countries to help them develop national plans. And the United Nations General Assembly and the World Health Assembly, which is the governing body of the WHO, in the past year, passed autism resolutions that are urging countries to help overcome the social and economic challenges. And we are seeing some of the poorest countries around the world, Albania and Bangladesh, for instance, who are implementing national strategies to implement this resolution. So when will the United States listen? We should be leaders in this area, not followers. So I'll leave you with this. Autism Speaks will not quit on these families, and these families will not quit on their loved ones, so neither should the federal government. The United States, it's time to listen. Autism Speaks is here to help. This community is here to help. We will work with you, but we need you to take leadership and action in making this a reality. Thank you.